So, Bishop, thank you very much. It's really a pleasure to be here today, and just to elaborate on what the government is doing on matters of healthcare. Many people think that the public hospitals should be in competition with the faith-based and the private hospitals. That is not it. Actually, we complement each other. And I walked in when Professor Chacha, you were just about to begin your presentation. And when you went on and on, then for me the need of us being together, to work together, the faith-based, the private, and the public became more eminent to me. And as you went by through your presentation, I was a little bit embarrassed and ashamed about the public facilities. What you mentioned about the many help with those names, I can't remember them properly, that you gave, that a patient may have to go through before they get to a facility where they eventually get care. Unfortunately, that is our healthcare system as it is. That is a perfect picture of the way it is. Do we have to remain that way? No. I believe you all agree with me that that is not what we want to have in terms of our healthcare. So has the government thought about what it needs to do? Yes, it has. And we have a plan. But based on your presentation, Professor Chacha, I could see the inadequacies of public facilities. That most of the time, probably there is no health worker to assist the patient. If the health worker is there, there is no equipment for the health worker to use to do proper diagnosis to assist the patient. If the equipment is there, the health worker is there, you might just end up with an out of stock in the pharmacy as a patient. Some of these problems that we have in our public health facilities are man-made, are intentional by, unfortunately, our very own people. For example, breakdown of equipment in public facilities. It is a day-to-day thing. Many times you'll go to a public facility, you'll be told, oh, the X-ray today is not working. Oh, today we cannot do dialysis, the machine is not working. Oh, we don't have the consumables, or something like that. Not because it wasn't done, but somebody sits somewhere and ensures that it doesn't work, so that then they can redirect traffic to other private facilities. Bishop, I am going to make the public facilities work. That is my intention. And as they work, they will not be competing with faith-based facilities. No, we are going to be complementing each other. The reason why public facilities, and I'm sure that I'm going to make it work, is because of our long bureaucracies. If today we were to decide to buy a CATH lab in a public facility, it will take us more than a year before the memos are done through until they get to me and I get to convince other people that we need that CATH lab. It will take several years. We'll have lost a number of patients. And that is why I'm saying I will make it work. Faith-based will continue doing your service. Those doing the private sector will continue doing it, and we'll be able to complement each other. So where are we headed as a country of matters health? Or what is my dream and what is my vision? What plan do I have? We have to go back to the basics as a country. I'm happy that today we are celebrating very high-end equipment. But remember, a patient comes from somewhere. By the time they get to a level that they need this equipment, if it is not an emergency, then they must have been struggling with something throughout. So we want to go back to the basics, and we have decided that we are going to focus on preventive and promotive health. In the next 1 month, we are going to roll out 100,000 community health promoters. Each of the community health promoter will be responsible for 100 households. We are going to give them gadgets where they can collect data. Siemens, you've said data is important. So they'll have some small gadgets. We are going to kit them that they'll be able to do the basics that they can do with a patient as they walk through the hospitals. That is where we are going to begin in terms of working on the healthcare landscape of this country. So we have an ambitious plan of ensuring that UHC works, and basically it's just to ensure that people have access to quality healthcare without suffering any financial losses. I know many times when I get to facilities like this, then the big question of health financing comes up. I'm also working on NHIF. We are going to reform it. People are telling me, oh, there are big cartels in NHIF. You may not be able to deal with them. But Bishop, you promised me yesterday that you'll be praying for me. So continue praying for me every day. And because of your prayer and the prayers of many Kenyans who would like to see change, then as a minister, I am not going to fear to act. Neither am I going to act in fear. I will do what I can do within the time that I'll be serving as a minister. As we reform NHIF, we want to have a new vehicle, a social health insurance that takes care of the needs of Kenyans. That should a patient choose to walk to Coptic Hospital, Coptic Hospital will have its bill paid by a new national social health insurance scheme. Why do I say the new one will work? Because one, we are developing an essential package. Two, we are costing. So there will be a tariff. And it will not matter where a patient gets care, whether they get it in public, whether they get it in private or faith-based. It will be based on the tariff. We shall verify the claims and they will be paid and be paid promptly. So all our plan is to ensure that primary health care, level 1, level 2, is publicly financed. Secondary health care, we are going to use the social health insurance that I've said that we are going to have. While level 5 and 6, our plan is to have a critical illness fund and emergency fund. So that should a patient need critical care or need emergency, like the guy who was running, the footballer, then all of a sudden, they should be able to walk into a facility and be taken care of through the emergency fund and the critical illness fund. And that will be working at level 5 and level 6, where I believe Coptic Hospital now is one of them. So Bishop, ladies and gentlemen, I do not want to bore you with a lot of things, but just to tell Coptic, congratulations. And I'm proud to be here because I know you are not one of those that provides fictitious claims to NHIF. That is why I decided to come, to demonstrate that I know there are good faith-based facilities outside here. And Kenyans know it. They trust your facilities. So you will see them very soon flocking here to use the services of the CATH lab. And I want to believe that we should be able to work together with the NHIF so that then the services that they get here through the CATH lab should be able to be paid for promptly by the government. Asanteni sana and have a good evening.